Welcome to the Enterprise Mobility Roundup podcast, brought to you by Bluefletch. We discuss technology topics related to Android and workforce devices and how they intersect with business and mobility.
Hello, I'm Brett Cooper, and today I'm joined by DeHihns for another episode of the Bluefletch Enterprise Mobility Roundup podcast. We're going to be covering a topic that Lee is going to be speaking on later this year at a conference, specifically around healthcare. And I'll read the title of the presentation, or else I get it wrong because it's a little long. We might have to figure out how to cut some words out of this, but it's titled "The Real Cost of Device Downtime in Clinic Mobility," and the subtitle is "What is 30 minutes of downtime cost?" And I think this is a transition from we've been working in retail, logistics warehouse. A lot of these other organizations started working with healthcare in the last 2 years and thinking about a lot of the things that are similar and a lot of things that are very different in healthcare. And Lee was going to cover some of those key points at his upcoming presentation. So wanted to walk through some questions I had on it and dive into some of those sub areas. So Lee, thank you for joining me today.
Yeah, thanks.
So the first question, and I mentioned we've been doing a bunch of different types of industries over the last decade. When you're looking at the healthcare space, I know you've run a couple projects in that. Like, what else have you done in healthcare? What's your credentials? You're a former doctor? Do you play one on TV?
I've played a doctor on TV. No, aside from the healthcare customers that we've worked with up to this point, I have some personal credentials, I guess. My wife is a OR charge nurse, and a lot of our conversations are around operational improvements and things that she sees in her day to day. And what I've discovered is, based on our history as an organization, a lot of what Bluefletch has done in other industries like retail, manufacturing, warehousing, and logistics, there are lessons learned that do transfer over. And we did learn that, particularly in some of the healthcare customers we've talked to, is because they're a little bit behind in terms of the shared device ecosystem than other industries, they are looking for what has worked with a different lens on what the measurability is. So their focus is going to be on patient care and clinical outcome and clinical mobility, but the tools in a lot of ways are going to overlap. So I think our credentials to some extent are transferable, but then just personally, I have a stake in this just from the point of view of living with someone for the last decade and a half and understanding where she's coming from and what sort of challenges her organization she's worked for face.
So really, you just want your wife to stop complaining less about the shortcomings of technology in healthcare. Got it.
I would hope her.
And I know when there's certain areas in the clinical space that there's a lot of cool technology, interesting technology. When you think of the bulk of mobility technology and technology for frontline healthcare workers or clinical workers, what does that typically refer to? What does that space look like for you?
Sure. So, most of there are different departments in the hospital, obviously, in different ways the frontline workers are going to interact with technology. But if we're talking about like floor nurses, clinical frontline workers that are on the floor dealing with patients day in and day out, a typical technology stack for them could be a mix of their own phone, like their BYOD device. That could be Android, it could be iOS. It could be what is called a workstation on wheels, or a WOW. So that's literally a computer on a cart that gets rolled around and follows them, or even one that is attached in a room that pulls down from the wall. And in some cases, a telephone that they're carrying, like a decked phone, and or even still a pager. So it's a pretty complex tech stack that has a lot of fragmented interfaces and a lot of specific tasks that I think could be consolidated down quite a bit from unifying that into one shared mobile device for them that would help streamline a lot of things.
There's just a lot of different pieces that can break along the way as well.
Mm-hmm.
Speaking of that, so that we were talking about the downtime of devices. So I know in typical example is you have a crash, or something doesn't work right, or device doesn't charge right. There's all sorts of things that can go wrong with technology along the way.
Mm-hmm.
I think the thing I would wonder is if you have like 20 different pieces of technology, there's more things to go break. For you, like, how do you define the cost of a downtime? I know it's let's talk about the other industries like retail or logistics or warehouse. Let's take warehouse. How would you define the cost? And I think you had like a $500 analogy for a logistics center that where a device goes down or technology goes down. Can you talk about what those costs would be and then how that translates into healthcare?
Sure. So, we've talked about like you said, the $500 analogy. So in logistics, for example, if the device is down, then an employee can't work. If you're paying that employee $20 an hour, that's the cost of paying that person to not do anything. On top of that, you're paying the IT person or the IT team $80 an hour to fix that problem. And then the company is going to be losing $400 in value just because someone can't fulfill an order, can't deliver a product, can't pick an order, can't stock a shelf. Those kinds of things really add up quickly.
So,
And then
so in that example, like that's $100 of seen costs and $400 of invisible costs.
exactly. And then, I think that could easily be much higher depending on the value of the products that you're trying to move. And then if you transfer that to healthcare, um, set aside for the moment the financial side of it, it's much more critical. This is literally life or death. This is people who are not well and need to be made better. And if technology not working is getting in the way of patient care, that's the ramifications for that. You can't put an actual dollar cost on from the point of view of that person or that person's family or that person's quality of life.
So
So they're probably
you do have the cost of the known cost of the $70 for the nurse and 100 or $600 an hour for the doctor and then the whatever the room costs. So you do have your fixed costs, but the visible costs are these ones where life or death and just it's completely intangible, right?
yeah, 100%. Like a $400 invisible cost in logistics is nothing compared to someone not either having quality of life anymore or even not having a life, period. So it's that much more crucial, I think. And um, from that perspective, you can learn lessons from retail and logistics and transfer them to healthcare. But I think the biggest challenge that we're facing right now is getting healthcare at an organizational level to understand how much more empowering their frontline workers can really affect these outcomes.
When you think about the money flow in healthcare does definitely I call it money flow, but it's the how organizations get paid, how they pay out, how the finances work. I feel like there's a much more complex web in a lot of the healthcare organizations because of certain doctors or contractors. You have Medicaid, Medicare, insurance. When you think about that and then try to tie that back to some of these other things around the outages and the types of technology that clinicians and clinical workers have on the floor, what are the things that you can draw like clear delineation around like I guess how do they get paid and how do you actually tie that back to the technology and the work that's being done?
Sure. So I don't if you've ever been unfortunate enough to get a healthcare bill in the mail, if you've ever stayed in the hospital, you'll know that the line items in there are extensive, to say the least. And each one of those things that is in there is because someone that was doing the frontline care and that work has charted that, meaning they've tracked everything that has happened to you or to a patient in that facility, what treatment they've received, what food they were given, what medications they had, what procedures were done. All of those things need to be charted essentially in real time as they're happening because that is what the healthcare organization needs to turn over to. It's Medicare, it's Medicaid, it's the state, it's the insurance company. They need to have that information to pay their doctors out, particularly if they're contract doctors, like you said. So the downtime around not having the ability for a frontline worker to be charting in real time where they're caring for a patient is going to be is massive. That's why there's a whole ecosystem of companies that do nothing but going back and auditing charts for healthcare organizations to make sure they're optimizing their costs and getting reimbursed as much as they can.
I was actually talking to a doctor about this recently that works in the ER, and they were articulating how their pace of what they do when they're seeing patients is so fast that they end up having to do the majority of their charting and write-ups at the end of their shift when they're not on the floor. And I can imagine there's probably a lot of things you're missing when you see, I'm going to call it that, 6 to 20 patients an hour over an 8-hour shift, and then try to remember it all in the last 2 hours every day.
Yeah, if you went a whole day and did, let's say, 100 separate tasks, but didn't go back and start taking notes on any of that until after 8 hours of work, the you're going to be super tired and super inaccurate. So it's even more critical in healthcare just from understanding what you need to do next to help that patient out and increase those improved outcomes. But then also from just the financial side of it too, it's critical to be tracking that stuff in real time.
So moving on to one of the other topics you had in your slide deck when I looked at it, you had a maybe controversial, maybe not, but the workstations on wheels, or WOWs, as they're known as in the healthcare space, are outdated. Like, what's from your perspective, why are they outdated? What are the things that hospitals and the healthcare environment should be doing differently with those and or other technology? And why haven't they moved away from them or updated them?
Sure. So yeah, I think they're outdated because it's an old way of working from the perspective of uh, you are relying on the availability of a scarce resource to have that available at all times for the frontline worker to be able to do their job and track what they're doing at the same time. Um, Despite the fact that these are on wheels, they're not necessarily super mobile. Um, they're not necessarily very easy to move around, and when they break, you are just kind of in a position where you have to choose between tracking what you're doing and actually caring for the patient. And so sometimes you're going back and forth to the central desk on a floor to track what you're doing from a charting perspective, and then going back out and treating that patient. Um, I think a lot of it is there's so much sunk cost in that infrastructure, and it's been around for so long that there's probably fear around what I've heard people call the rip and replace, where if you're going to take, let's say there are 15 workstations on wheels for a particular floor, and you're going to replace all of those, there's workflow changes that need to go into that, not only from an IT perspective, but from an IT support perspective, but then on how frontline workers are working as well. And when you have a nurse caring for on average 6 patients per shift, if they're on a floor, it's difficult to set aside time to take away something they already know how to use, put something else in their hand that's going to mobilize them and make their job easier, when really all their time at work is dedicated to caring for patients and not doing training. So I think the fear around the rip and replace is really a reimagination around how healthcare and technology need to work together.
I know one of the things, and it wasn't in your presentation, but we've talked to folks about this recently, is the I'm going to call it decks, or extended workstation blades. Actually having fixed monitors and being able to cast from your mobile device to one of these. And we've been doing this as consumers with Apple TV for 10 years, or whatever it is, Google Chromecast for 10 years. And I feel like that would be, to me, seems like a easy replacement if you had the right mobile technology in the hands of the healthcare workers. Like, what's your thoughts around that? Or have you seen very much of that?
We've definitely seen a lot of thought around that and requests coming from not only software vendors, like some of the larger ones that are out there, like your Oracle or your Epics, are definitely going in that direction. And also from an OEM perspective. So these are the actual mobile device manufacturers that are in that space. They are also looking at this as well because they understand that if I'm a doctor doing rounds, or if I'm a nurse seeing 6 patients, if I can walk into a room and simply tap my device on the monitor that's likely already in there for infotainment purposes or other reasons, I can put that up directly in front of the patient, and we can essentially see side by side what their care plan is, what next steps are, what they've done up to that point. It's a lot easier than, you know, hospital rooms are not big, and trying to bring a wow in there and slide it around if there's a family member or, um, you know, other machinery in there, like breathing apparatus or medication dispensing, it's a little bit difficult. And I think it's just a simpler process to be able to walk in with something that's in your pocket that follows you around wherever you are.
For and shifting gears here, I know in the slides you mentioned some of the Blue Fletch case studies we've done with healthcare providers. As as these organizations um, transition to what be it an Android device or a mobile device, what are some of the hurdles that they run into? And then on the flip side, what are some of the things around efficiency they've seen with whether it's with our tools or some of the other tools that are out there in the mobility landscape?
Sure. So I mentioned it a little bit earlier or alluded to it. Some of the hurdles are going to be it's a reimagination of the workflow process. So when we first started our conversation today, we talked about a frontline worker could have a decked phone, their own phone that they're using for work, and also a pager. And then in addition to that, they have this workstation on wheels that they're using. Consolidating that all down into one device is a reimagination of how you're deploying your technology to your frontline workers. So you're going to be doing charting, communications over voice, communications to other members of the clinical team, and charting all on one device. So if your team isn't accustomed to shared mobility or Android, for example, they're in a Windows-based world and a PBX-based world, there is some education that needs to happen in there. But that initial hurdle of work, getting over that is going to really increase efficiency on the backside of it. I think it can be scary to think about that transition that has to happen. But once it happens, I think the growth curve on the backside of it from an efficiency perspective is going to pay for itself and just in terms of reduced friction.
Got it. The ROI of this, like with there's the basic ROI of like, less devices to maintain, less cost. You talk about some other things, being able to serve more patients in a shorter period of time, less time spent dealing with the technology. But I think there's a lot of other um, hidden costs associated with just some of the legacy technologies out there. What are the things that you called out in your presentation or that are worth mentioning as you've been talking with customers around this?
Yeah, I think, once the new model is rolled out, your healthcare IT team is going to be focused a lot on improvement. And what I mean by that is taking the existing technologies that are there and improving the process for the clinical mobility, patient outcome side of things, really focusing on what the hospital is supposed to be doing. They're not going to be focusing on fires in terms of why are all the computers on a particular floor not working today. It's going to allow more face time with the patients from a frontline worker perspective. It's also going to give you a lot more information on location of staff. So with staff being scarce, um, particularly in an environment where it's shift based and you're trying to measure and anticipate what you're going to need for the next shift after the one that's currently happening, planning ahead, knowing where your employees are at all times is going to be super helpful, not only operationally, but also from a safety perspective. The not great reality is being in healthcare, particularly in an ER environment, can be quite dangerous in some cases, depending on the hospital. So having a specific understanding of where your employees are, even what applications they're using, gives you a view into what they're doing from just a pure safety point of view. And then finally, it's going to give you better ability to automatically track and record charting, in real time, not going back to your example, not being that doctor that has to go back and remember notes from 7 a.m. when it's 5 p.m. and they're finally sitting down to write down those things. It really just makes it a lot easier.
I think
That will allow those to be folded together.
there's also that once you start being able to do that, then you actually can layer in some of these newer AI technologies too, because you have more real time data. Like imagine walking from one room to another and being able to record all of your notes, on your mobile device.
Mhm.
Definitely makes sense. One of the things, and I think Richard and I talked about this recently, but I think you also had in your presentation is frontline-centered design
Mhm.
and getting IT teams to think more about the users and the frontline workers. What's the root of that, or what's the heart of why they should be spending more time thinking about the actual end users?
Absolutely. I think it has a lot to do with starting with what you have the technology for. And that technology is to make the frontline workers' job more efficient, more effective, and be able to improve patient outcomes. So I think from an IT team perspective, it's a bit of a mindset shift. So I think we've talked about the phrase the focus needs to be on listening and not engineering. So stop over listening, stop over engineering and under listening. Um, so I think a lot of that comes from just understanding that nurses are going to adopt what helps and they're going to ignore what hinders. So to give you a concrete example of that, if there's a acute emergent issue in a room on a floor with a nurse, the first thing they're going to be focusing on is making sure that patient is better. And in the flurry of the moment, maybe it's 45 minutes later that they get back in front of a computer to be able to chart what happens is going to, if they're not going to be focusing on that in the moment. So if you can incorporate technology into what they're doing, it's really going to help that out. It has to work in the rhythm of their flow. You can't be over here helping a patient and then simultaneously trying to write down or chart specifically what you're doing. So the focus really needs to be on incorporating the technology into the rhythm and flow of how they work.
All right. So, in closing, you talked about a lot of different things. So, why mobility is important, the sort of some of the hidden costs of downtime and outages. If you had to give concrete, here's your homework, here's the next three steps to go work on. What are those things that you would recommend people start with?
Sure. And I say these knowing that these are easier said than done, for sure.
As everything is, yes.
But so in closing, what I think can be helpful from a healthcare leadership perspective is really just getting on the floor with the frontline workers and observing what's going on and observing it from, and this is the most difficult part, observing it from a beginner's mind point of view. So many healthcare leaders have a ton of baked in knowledge that is crucial, but the degree to which you can set aside that and just be curious and look at how could this flow or workload be better for a nurse, and don't necessarily try to staple the technology onto it. Just look at how the thing could be improved. And if technology is part of that, and I honestly think that it is, and when applied in the correct way, look at it from that perspective. Also, look at what other organizations have done. Um, I, I know that healthcare is very in its own world in terms of the uniqueness of the challenges that they face. However, if you look at like what a Walmart or an Amazon have done from a retail perspective, they've completely disrupted the industry in terms of how asset tracking happens, how go to market works, how communications with frontline workers, how communications with customers work, how inventory planning works, literally every facet of retail. Um, and I think you can look at that and focus on ways that you can apply some of those lessons to your organization, because healthcare is a complex organization with many moving parts, and they do have asset tracking, they do have planning, they do have patients who are the customers. So there's a lot of different lessons you can apply there. Um, and then lastly, what I would say is look at the process of the patient, because that, at the end of the day, a healthcare organization, their job is to make someone leave better than when they came in. There are a lot of barriers inside of healthcare that are going to make that difficult. Regulation, insurance, legal liability concerns, privacy. But I don't let that stop you from looking at small wins that you can take to make incremental improvements. Just think about if you took the 4 devices that a nurse may interact with on a daily basis, meaning like a pager, actually a fax machine is one they still work with, a DECT phone, a computer, maybe another computer on wheels, and maybe their own phones. That's actually 6 devices. If you can consolidate down that down to 1 device just for communications and charting, for example, that's going to make a huge difference. And you don't necessarily have to touch on like regulation or insurance or any of those things, because there is software that is HIPAA compliant and privacy aware that will allow you to continue to do those tools and those jobs.
Awesome. Yeah, I like that one the best. Focus on the patients. How do you get them in and out better and healthier? Love it. Lee, thank you very much for walking us through this. I know you and your team are attending a number of healthcare conferences later this fall and are speaking at some of those. What do you guys have lined up, or what are you heading to?
Sure. So we're going to be going to Health, which is in October, I believe the 18th and 19th, in Las Vegas. And then we're also going to be going to HIMSS first quarter of next year, which is a large technology conference. Maybe at HIMSS even exhibiting inside of an OEM booth as well from a mobile Android perspective. Some of the things we're focused on outside of our existing purview is also expanding into device support that's more reflective of the technology landscape that a lot of hospitals have deployed. So definitely keep in touch with us for announcements we're going to be making over the balance of this year.
Awesome. Thank you, Lee, for walking us through this. And if anyone has any follow-up questions, feel free to reach out to us at info@bluefletch.com or hit us up on LinkedIn and any of the other ones. But thanks again for following along for another episode of the BlueFletch Enterprise Mobility Roundup podcast.
Thanks, everybody.
Thank you for listening to the Enterprise Mobility Roundup podcast. If you enjoyed the discussion, please take a few moments to rate us. If you would like to listen to future episodes, please subscribe. To learn more about mobility topics or submit any questions, visit us at bluefletch.com.